Hello, everyone. Thank you for being with us this morning. I'm Millie Swan, Vice President here at Forrest Health, and we're very pleased to have with us today the Speaker of the House, Philip Gunn, and he heard from us this morning briefly about our COVID situation and our needs. So I'm going to turn it over to him and let him make a few remarks about his visit. Speaker Gunn.
Thank you very much. Well, thank you, and good morning. I have just a few minutes to be with you. I'm here today to hear from the leaders of Forrest General to find out exactly where they are in fighting the COVID situation and what they need. I'm here on behalf of the state to offer our support for what they're doing. First of all, let me say very grateful for the fight that they are waging. We all know that our health systems are being pushed to the limits. I hear this all around the state. I have heard from hospitals in Lucedale and Pearl River and in Jackson and North Mississippi and the coast, how their capacities are being stretched. And so we're here today to talk to them about what they need, what's going on, how we can assist, and felt like it was very important to come here firsthand for myself and see it firsthand so that I could see exactly what the situation is. They gave me a lot of data, a lot of information, which is very helpful, and it is my intention to try to go back and develop a plan that we can use to help them as they wage this fight. But again, let me say, very grateful for the efforts that they are putting forward. I got reports of staff and doctors and nurses and respiratory therapists, all of whom are working overtime just to go to the extra mile to make sure that patients are taken care of and that we're fighting this COVID virus. So I'm very grateful for them. I want to acknowledge their efforts and make sure the world knows that they're out here putting forth their best foot to make sure that the health of our citizens is taken care of. So that's what my mission is here today. I've got just a few seconds, so I'll be glad to answer any question that you may have.
Mr. Speaker, do you foresee any special session to deal with the rise in COVID in the state? There's some rumors that might be taking place.
Well, I'm in favor of doing whatever we have to do to help fight the virus. I think we're seeing a resurgence here. The numbers bear that out. We stand ready as a legislature to do whatever we have to do. We've got the financial resources from the federal government that we could use. We talked a little bit about that this morning. And if it takes a special session for us to get those dollars out, I'm for that. We're ready and poised to do what we can as a legislature to help our hospitals all around the state to fight this thing. We've got to get it under control. We've got to get past it. And we're at a crisis situation, I believe. And I'm not just trying to be an alarmist. I'm basing that on the information I have received from hospitals around the state. This is one reason I'm here in person, to see it for myself. And I'm headed this afternoon to Gulfport Memorial, and I'm headed to Singing River. I toured University Medical Center in Jackson earlier this week, I want to see this for myself. And I'm convinced that the time is now for us to be acting and doing whatever we can to get the virus behind us.
What's your reaction just to the sheer numbers? We've got the highest in the state since April. What's your reaction to those numbers?
Well, obviously the Delta variant has presented a new challenge for us. I'm no medical professional, but one of the charts that Andy showed me showed the track record of this. Started in March of last year, and we saw the spike when it first hit. And as you know, y'all may remember, he pointed out the very first case in the state of Mississippi was here in the Hattiesburg area. So it went up, and then we saw the vaccinations come online, and then you saw the chart decline, and it's been down. And then all of a sudden there's this enormous spike that went well past the spike of last year, or whenever the spike was last year, the Delta variant. And we also saw that the age group has dropped. Last year with the spike, and I'm trying to do this from memory, Andy, so I may not have it right, but it seemed like the average age was 65, and then the 57 was, what was that, Andy? It was 57, and well, now it's like 35. And so we're seeing a younger population struggling with the Delta variant. And so that presents a new challenge. We obviously taken the advice of the medical professionals on how to fight that, but we are, like I said, we stand ready to do what we can to help get this thing behind us. And I just wanted to come today here for myself and offer our support on behalf of the state of Mississippi to the doctors and the nurses who are here fighting this fight. Tell them we stand ready to do what we can to help them. We got the money. I'm ready to put it out there to the extent that that will help. We want to do that.
What's your impression of what you're seeing, the sacrifices, the dedication of the medical professionals?
Well, this hospital holds particular significance to me because this is where I was born. A lot of people don't know that. I think it was a very professional presentation this morning. We had a number of the doctors in there. We had the doctor, the head of nursing, the head of ICU, the head of the emergency room, other professionals in there, and they all gave me a very thorough recap of their situation, and they provided a lot of data, which I'm very impressed with. And again, I think they're doing a fantastic job of fighting the fight. So I'm sorry I've got to go. We got to get on the road to Harrison County, but I appreciate all of you being here, and thank you for your interest. Let me say a few words. Thank you.
Thank you
All right.
so much.
Thank you.
Appreciate you very much.
Sorry I've got to rush off. Thanks, sir. Thank you.
Thank you, Speaker Gunn, for being here today. At this time, I'd also like to ask Dr. Steve Stogner, who is our critical care medical director, to come forward and give you an update on our ICU situation.
Good morning. We appreciate the speaker coming this morning and seeing firsthand exactly what we're facing here. As he said, the Delta variant has posed significant challenges to us from a capacity of taking care of critically ill patients. Indeed, we're seeing younger patients. Over 60% of our intensive care unit capacity is occupied by COVID patients. We have a 50-bed ICU, one of the largest in the state. So that leaves 14 beds for all the other types of critical care issues, heart attacks, strokes, car wrecks, and other types of trauma. We are doing all that we can. We need more nurses, more respiratory therapists. A room that we call an ICU room is not an intensive care unit unless you have nurses and respiratory therapists who are highly trained in order to take care of these patients. I am blessed to be in a facility like this that is dedicated to taking care of our community, our patients. It is an overwhelming job, but we're going to make it, and we appreciate the speaker coming down here. We appreciate the administration of this hospital moving at warp speed and dedication and commitment so that we can deliver the best quality care throughout this hospital. And that includes every service from the emergency room to the intensive care unit to the hospital floors. So I just want to, again, thank the speaker for the attention that he's given us to show him firsthand what it is that we're dealing with here. This is not a joke. This is not just a media topic. This is absolutely a serious crisis that we're in. I appreciate it.
I'd also like to introduce Dr. Eric Jordan, who is the medical director for our ER, and he's going to give us an ER update at this time.
Thank you. Yeah, I'd like to piggyback off of Dr. Stogner just saying thank you for the speaker showing such interest in coming here. I'd like to say to Hattiesburg and all of the surrounding communities that we service, let people know that we're seeing lots of COVID cases in the emergency department. Unfortunately, we are seeing a younger population get sick, sometimes sick enough to be hospitalized. So we can't let our guard down. We have to be diligent and continue to use good common sense. wash your hands frequently, avoid large gatherings. If you find yourself around a lot of people, wear a mask to protect yourself and others. And if you're not vaccinated, please consider getting the vaccine. It's shown to save lives. Thank you.
We appreciate you coming today, and this will conclude our press conference, but I'm sure that Dr. Stogner and Dr. Jordan will be glad to do any interviews if you'd like to do that 101. Thank you.